What is up? I'm literally so excited to chat with you today about Dupuytren's disease because I get questions about this a lot and I haven't dedicated a time to just sit down and make content about it. So here we go. We're just going to do it live. Welcome everybody joining. We're going to talk about Dupuytren's today and some Dupuytren's exercises. So I got a question when I put it out there about what are some hand exercises for Dupuytren's, and I really want to address this today. There's a lot of information about post-operative exercises, but there truly isn't enough information or even data or studies about exercises or ways to prevent having to do a procedure or a surgery for Dupuytren's disease. So that's sort of where I want to focus on today, just because I feel like there's not enough information out there. And I also do want to say that these are all my theories, because there's not necessarily evidence to say exercises can work to prevent surgery or a splint could work to prevent surgery. This is all just my clinical knowledge sort of being applied to a pre-operative or trying to avoid prolonging a surgery or trying to avoid a surgery if you have Dupuytren's. So first, let's just talk about what the heck Dupuytren's is. It's first of all most common in people of Norwegian descent, and it's really common in people with large hands and large feet. You can actually get Dupuytren's in your feet. I don't know anything about the foot. I literally only do hands, y'all. You know this about me. So we're going to talk about the hands today. I'm also excited about this because I'm actually at risk for developing Dupuytren's. It runs in my family. My dad has it. He tells me a story that when I was a kid and that we were reading together, I was the first person that noticed that his hand had something on it. And I was like, "What's that, Daddy?" And he's like, "I don't know, that's weird." And then I don't know, fast forward to just a few years ago, he had his first procedure done for it. His sister also has it. I'm pretty sure I'll probably get it. I'm very tall, very big-handed, Norwegian descent. But it is most common in people with that gene. Oh, your neighborhood OT, my dad has it too, both hands. Okay, yes. When did he start to notice it? My dad says I was maybe 10, so that was 20 years ago, and he went for a long time without getting any sort of procedure done. He was still very functional, and because it happens so slowly over time, people just learn to live with it and to adapt. Okay, in the 60s, yeah. So let's talk about what Dupuytren's is. It is an overgrowth of connective tissue within the palm of your hand, and most often in this side of our hand. I've seen it some over here, and I've seen it everywhere, but it truly is I feel 80 to 90% of the people would get it on this side of their hand. Okay, Missy Neely, I have it on both hands. Got it after I broke both wrists. I wonder if your body was if maybe you had that gene, but your body was responding to that fracture and was heal, 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 connective tissue, connective tissue, connective tissue, and it brought it out sooner maybe. Again, that's not scientific fact, but that's just me wondering. So it's an overgrowth of connective tissue on this side of our hand. We all have bones within our hand. So we have 5 metacarpal bones. They are here, 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 and here. And so they're underneath each of our fingers. 5 fingers, 5 metacarpal bones. We have ligaments that connect those bones together. We have ligaments that run this way as well as up and down. And ligaments are made out of connective tissue, right? Or they're a fascia. They're a type of connective tissue, fascia. And they connect bones together. Dupuytren's disease starts often with a very palpable or a touchable, you can notice it, you can touch it, you can feel it, a mass right in your palm. Right here, usually around this upper half of your palm, usually around that crease right here. And you can also get masses in your finger joints. That's where I first noticed it on my dad's hand, ironically, but that's not as common as it first starting right here. What happens is, as this mass becomes larger over time. So it kind of starts with like an overgrowth of like that connective tissue that's lying in between your bones and your hands. And it grows over time. You have a gene that just makes it, your connective tissue just goes on fire, right? Just grows over time. And then all of that extra tissue adheres to tendons within your hand. And that's sort of like where the issues with your range of motion and losing the ability to open up your hand can come into play. So let me explain more about like the tendons in your hand. So we all have muscles in our forearm, and when you make a fist, you can actually feel those muscles contract. That's because the muscles that are down here, some of them have tendons that come all the way up through your wrist, through your hand, and all the way up to each fingertip. And those tendons are what pull your fingers down into your palm as you make a fist. So back to Dupuytren's. We have all this extra connective tissue in our hand that's like grabbing a hold of everything. It grabs a hold to the tendons that are within your hand. So like the tendons sort of on like this side of your hand. And it doesn't allow them to contract or to move. And so slowly over time, those tendons, because they're like adhered down by all this connective tissue, you become like less able to extend your fingers back because, well, sorry, let me back up. It still allows your muscles to contract. Your tendons can still contract, but because it's like freezing your tendons right here, you can't pull your hand back anymore. It's almost like glue. Like it's almost like gluing, the connective tissue is almost like gluing your tendon or freezing it right here, and so that you can't pull it back because there's too much tension between all of that extra connective tissue going on with Dupuytren's. You can still make a fist, those tendons can still move enough to contract and pull your fingers down, but what often happens with Dupuytren's is that you have a really hard time extending your fingers back, and in some cases it can even bring these joints down as well. And so like, you know, when it progresses to this point, it's like stuck like this, like you actually can't pull it back up. And that's often when surgery is usually recommended, because when you get to that point, you really lose a lot of function in your hand. I just wanted to show you like what Dupuytren's looks like. So here's one of my handy dandy rehab of the hand textbooks. And I just wanted to show you like what the connective tissue tends to look like. So if you can see that little picture, there's just extra connective tissue there. You can see it there too. It starts as like a mass, and then you can see in this picture, it's pulling that finger down. Here's the tabletop test. So a good way to tell if you like maybe have Dupuytren's and you're wondering, aside from like literally seeing that nodule, that node, if you lay your hand on the table, you can't lay it flat. That's like the tabletop test, another way to tell. Again, there's very limited to no evidence, in my textbooks at least, about like what to do before surgery. Like I feel like we really, like as a community, or as like the healthcare community needs to like explore that further, because why not? Like, why not try to like avoid procedures or surgeries? But I really do believe that there's no harm in trying. There's no harm in trying exercises to try to counteract that force, especially if you're noticing at the beginning, if you're noticing that you have that like bulky extra connective tissue, but you're not like all the way down here yet, because a lot of the exercises I'm going to show you today do require like motion of your hand to some degree. But why not try, you know? If you have Dupuytren's and you've already had surgery, you will get assigned a hand therapist, and they will show you exercises. Honestly, a lot of the exercises are probably what I'm going to teach you today too. But I really am trying to target people that haven't even like had the procedure done today. And there's like at least I think 3 or 4 different like procedures, all the way from just like an injection to literally like open surgery where they remove that tissue. But you can talk to your orthopedic doctor about what might be best for you. So if you have Dupuytren's, I would recommend putting some heat on your hand before trying to like do these stretches or exercises. Why? Because heat helps to like loosen everything up. It tends to make things more pliable. We tend to get a little bit more of a bend or like a stretchiness to our like soft tissue, such as our connective tissue and our muscles and our tendons, when we put heat on our hands. So I would recommend putting like a heating pad, or if you have a rice sock or some other form of heating device, paraffin wax is amazing. But put heat on your hand for maybe 20 minutes or so, or 15 minutes, however long you can. You can even wrap your hand around your hot coffee mug in the morning, okay? Because I know you can, if you have Dupuytren's and it's not progressed too far, you can probably still do that, wrap your hand around a coffee mug. Let it warm up for 10 or 15 minutes, 20 minutes, whatever feels good for you. And then I want you to try to stretch it now that it's nice and warm. So one of the stretches you can try to do, let me see if I can pull my phone down. Beautiful. Is like what I would call a tabletop stretch. So let's say you're failing the tabletop test. Let's say your Dupuytren's has you right here, and when you put your hand down, it doesn't go flat. You could literally just put your hand on a flat surface like a table and try to put pressure on it to try to straighten it out. Even if you're not able to get it all the way straight, you can still benefit from like trying to and applying that stretch, that pressure onto it. We're not forcing anything. We're not talking like pushing through pain or anything like that, but just trying to get like a nice stretch through there, and holding for, I mean, the longer that you can hold, the better, especially for stretches, upwards of 30 seconds or so, if that's comfortable. And then you could release, and then you could try that one again. You could also do the prayer stretch. And this is also just good for anyone with any like hand or wrist stiffness in general. But when we're thinking about Dupuytren's, let's pretend this is my Dupuytren's hand and it looks like this. You could try to just bring your hands together, and using the pressure of like both hands together, bring your hands down, try to keep your palms together, bring your hands all the way down and try to flatten out that hand like as much as you can. And then we would hold for 10 seconds, 20 seconds, 30 seconds, whatever feels good for you, working it all the way down as far as you can. Let's see, another good stretch would even just simply be like, let's just try to like pull our fingers backward using the other hand. Okay, so if we're here with Dupuytren's, and again, most of these, like if you're down here, you could just try to like gently get as much like open as you could, or like as much of a stretch as you could. But these probably would be best for someone that is more of like in, you know, like this range of Dupuytren's. So you could just try to like gently stretch your fingers backwards and hold. Great to do while you watch Netflix. I literally love doing like all of my hand exercises while I watch Netflix because I feel super empowered and productive. Not that you have to feel productive. Like sometimes you just need to like chill, right? Sometimes I just need to chill a lot and watch Netflix. But anyway, I do love doing hand stuff during Netflix because your hands are right here. Any other ways that you can think of that possibly would be stretching your fingers in that backwards direction? Okay, so we just covered like at least 3 stretches that you could try if you have Dupuytren's or if your fingers are stiff in that backward direction. And once you've done heat, once you've done stretches, then you can actually do exercises to strengthen your hand in that backwards direction. So I'm going to show you a therapeutic exercise for finger extension. And again, like just meet yourself where you're at, like especially with these active motion exercises. It's going to look different on everybody's hands because all our hands are different. So if your form looks really different than mine, like that's totally fine. Just do the best that you can. So you take your putty, I rolled it into like a hot dog shape, and then you can make a circle out of your putty. This also works with a rubber band. I don't happen to have a rubber band on me, but you could use a rubber band or a hair tie as well. Put your fingers in, and then open your hand up. With Dupuytren's, you might not be able to open it up all the way. Again, that's fine. We're just applying resistance in that extended position backwards. We spend a lot of our time as humans in this frontwards like flexion posture, right? Like engaging with all the things that we need to do in life. Like we're never really like, forced or strengthened backwards. And so it is good, you know, even if you don't have Dupuytren's. to practice some extension exercises to strengthen like the back of your hand and your forearm. But with Dupuytren's especially, we're trying to like kind of counteract that force that the connective tissue is pulling those, pulling on those tendons, pulling that finger down, okay? So again, you would just open your hand. And again, you could use a rubber band, you could use a hair tie. I'll do it one more time. You could do 2 sets of 8 to 12 of these, 2 to 3 sets of 8 to 12, if that feels supportive for you. So again, we're opening. Okay. And again, with Dupuytren's, you might not be able to open the whole way. That's fine. Give yourself grace. Be proud of yourself just for trying, and just keep doing it. You also don't need to do like all of these. I mean, you can just really find a couple that like resonate well with you too. Okay. Don't overwhelm yourself. When you're starting any new changes, just start low and slow, because otherwise it's not sustainable. If you try to make too many changes all at once, if you try to do 3 stretches followed by 3 exercises and heat all before, like you're gonna burn yourself out. Your brain's gonna be like, this isn't safe, like I'm really not used to all these changes. And then you're gonna find yourself like making excuses to not do it. So maybe even just start with like your hand in your coffee mug or your hot tea mug or whatever for several minutes. Do one stretch that you like, you know, even just pull your fingers backwards, or do another stretch I showed you, and then do one exercise. I'm going to show you 2 more exercises that you can do after you've done your heat and your stretching. This second one is tabletop extension. So remember when we put our hand on the table and we were trying to stretch it out? Well, if you're doing that stretch and you're already here, you may as well try and put an exercise to it and lift up each finger, okay? So with Dupuytren's, this side is gonna be the most difficult because that's likely the side that's most affected by your Dupuytren's. So you can start with the easiest to gain some momentum. So lift up your thumb, okay, perfect. Index finger, middle finger. I'm gonna flip y'all the birds, sorry. I love you. All right, this is probably where it gets tricky for everybody, not just for people with Dupuytren's, especially for people with Dupuytren's, but lifting up the ring finger from tabletop is actually really tricky, okay? It's like really hard just because of the way that our tendons are and our anatomy is. Okay, so that's tabletop extension. You would just lift up each finger. I'm holding my hand as if I have Dupuytren's, just to show you, because this is about Dupuytren's, but if you don't have Dupuytren's, there's nothing wrong with laying it flat and doing it that way as well. Okay. So you could do, you know, 5 to 10 rounds of those. Again, the ring finger is really the most difficult. So those are some exercises to work on those muscles that are behind your hand to counteract all the forces of Dupuytren's that are on the front of your hand. But you can also do tendon gliding exercises, which I'll show you in just a minute, because those help to glide the tendons that are within your hand, right? We have muscles that start in our forearm. There's tendons from those muscles that a tendon connects a muscle to a bone. So there's tendons that start in the muscles in your forearm, come through our hand, and connect to our fingers or our fingertips to help us to make a fist. Those are the exact tendons in your hand that are getting glued down by all of the connective tissue from Dupuytren's. And so by doing exercises that glide the tendons against one another in your hand and work on like lengthening or shortening or changing the position of the tendons that are in your hand, that can really help to create more space, like, and kind of like loosen things up when you have a bunch of connective tissue trying to hold it down, like with Dupuytren's. So for tendon gliding exercises, again, I'm gonna make my hand a Dupuytren's hand. If you don't have Dupuytren's, you don't need to hold your hand like this. You can hold it fully straight to start, but I'm gonna pretend I have Dupuytren's. So you would hold your hand as straight as you possibly could. You would bring it down to a tabletop. So you would start straight, whatever that looks like for you, bring it down to a tabletop. So we have a right angle here and then straightened fingers here. Then you would bend at just these joints. So we're gonna keep our fingertips straight and we're just bending at these joints. That's called a flat fist. If you were to one-handed clap, that's the motion, okay? So we moved from here to here. From the flat fist, we curl our fingertips into a full fist. Again, I have hypermobility, so whatever this looks like for you is absolutely perfect. Don't compare yourself to me, because trust me, my hands have their own issues. Like, they are too hypermobile. So whatever, again, meet yourself where you're at. Whatever this looks like for you is absolutely perfect. So you've got your full fist. Then you're gonna hinge up to a hook fist. And this is probably going to be very tricky for you if you have Dupuytren's, so just give yourself some grace. I'll show you with like a normal hand, and then I'll try to show you what it might look like if you have Dupuytren's. So we move from the full fist to the hook fist. So the only thing that's really moving is our back knuckles. They're going from bent to straight. So for Dupuytren's, depending again on what level of contracture you have, you might just only be able to come up to here, and that's fine too. And then you would, from there, straighten. Again, my hand's bent because I'm pretending I have Dupuytren's, as straight as you can go. All right, so let me show you that in more of like a real time, and I invite you to participate with me. If you've been around here for a minute, you know that these are like some of my absolute favorite exercises for like really anybody, but especially with a Dupuytren's contracture, again, it can really help to clear up some of that like connective tissue, create some space to allow your tendons to glide better. And it also could help prevent like a contracture from Dupuytren's to the point where you really can't move these fingers at all. Again, this is my theory. There really needs to be more research done about Dupuytren's, like preventative measures, exercises, splints, which I'm not going to get into today because this is just really about exercises, but just ways to prevent like a procedure from happening in the first place. All right, so we've got our Dupuytren's straight. We're going to bend, tabletop, flat fist, full fist, up to the hook as best as you can. And if you're having a hard time moving from full fist to the hook fist or full fist to the Dupuytren's hook fist, you can always gently help with your other hand. And again, don't give yourself a hard time if your hand doesn't look like mine. Meet yourself where you're at, and then back up straight. All right, I'll just show you one more time in real time with my Dupuytren's hand, and then you can keep rewatching this. I'm gonna leave this on my feed. I'm gonna make a YouTube video about this, and you can practice with me and just kind of keep replaying it. All right, extension, tabletop, flat fist, full fist, hook fist, and straight. Okay, this was so fun. I hope this was helpful for you. This was really fun for me, again, because I do have a family history of Dupuytren's, and I've, especially when I worked as a therapist in the hand clinic, I saw a lot of people post-operatively or once they'd already had Dupuytren's surgery, and the question always was, how do I prevent this from happening again? Because with Dupuytren's, a lot of people will get a surgery, but then they'll need another one like 5 or 10 years later because it comes back. Like, it just recurs. There's not really an end to it. And so there just needs to be way more research done about how to, like, possible prevention interventions. And I think exercises could be one of them. Maybe one day when I have a lot more time and space, I'll create my own research study about this, but you guys can be my guinea pigs. So let me know how this landed. Thanks so much for attending live or tuning in later. I love you all so much, and I hope that you have a lovely weekend. Bye.